Thank you very much, Franca, and it's great to be here and to see all of you here today. And I feel really honored and privileged to be giving this presentation. A couple of people have said to me that they weren't quite sure about the topic of my presentation. They weren't quite sure if they understood it. It's about standards. It's about the development of standards for pediatric palliative care and listening and responding to the needs, listening and responding to all that has been happening in children's palliative care over the last few years. So much has happened since we last met together here in Rome. For many of us, it's been a tough time. For many of us, it's also been a time when we have been able to celebrate as well. So mixed emotions for many of us, but great to be here again today. So I'm Julia, I'm the Chief Executive of the International Children's Palliative Care Network, and I feel really honored to be presenting this work on the standards for pediatric palliative care, as I was just part of a team led by Franca in the development of these standards. Because I didn't find out which was the right button to press, so... Aha, so there we go. So I'm going to be looking at standards. I'm going to be talking to you about the development of some new standards for pediatric palliative care. And why is this important? And why is it important for us to think about this at the beginning of this conference? Well, it's important so the children, like these 4 children that I've got in my picture here, wherever they live, regardless of what condition they have, regardless of whether they're rich or poor, regardless of what culture, regardless of what religion, every child and their family that need access to palliative care should have access to palliative care. And I know that all of us here are striving towards that development. So let's just think about the background. So we know, and the World Health Organization has said, that pediatric palliative care is an ethical responsibility for all healthcare systems. Every healthcare system around the world, every government, every Ministry of Health should be ensuring that pediatric palliative care is a reality within their country. But sadly, we know that this is often not the case. With over 21 million children needing access to palliative care around the world, we estimate that only 5% have access. So there's still a long way for us to go in the development of pediatric palliative care. And yet we know as well from work done globally and from Lorna's work in the UK that the number of children that need palliative care is increasing. So how do we make sure that they have access to such care? And it's been exciting to see the development of new models of children's palliative care, to see the developments in research. I was doing a presentation on research last week, and I just did a quick look to see the numbers of studies or papers on children's palliative care, with over 1,370 papers published in 2021, whereas back in 2006, it was just 185. So there's been a lot of developments in the field of pediatric palliative care. And there's also, many of us have seen the complexities of the needs of children increasing. And so how can we respond to that? And also there's an importance of looking at standards for pediatric palliative care globally. And the initial standards, which I'll mention in a minute, were very much focused on Europe. We know that there are barriers to the delivery of pediatric palliative care, and we know that those barriers can prevent us from applying the standards that we would like to apply. Many different examples. I'm sure if I went round, many of you could give examples of barriers, but access to medicines, gaps in standards even where they exist, they might not be applied. Maybe a lack of resources, either financial or human resources, limited development of models, lack of education, and of course the challenges that we have all faced in terms of COVID have just impacted, with many of our colleagues actually being moved to work in different areas, limiting the people available for pediatric palliative care. So there's lots that has happened. And the IMPaCCT standards were the original standards that were published back in March 2006. IMPaCCT stands for the International Meeting of Palliative Care in Children in Trento. Until I did this presentation, if you'd asked me what IMPaCCT stood for, I wouldn't have known. But it's the standards that were developed, core standards for paediatric palliative care in Europe. And it was the first time that a region had got together to try and develop uniform standards. These standards were published and they defined paediatric palliative care. They looked at best practice and models, and they identified minimum standards for the provision of paediatric palliative care. And these are the IMPaCCT standards. You can download them from the website if you haven't seen them. But they were very much meant to be a united document for Europe, defining and identifying standards of care for children with life-limiting and terminal illness. And these were aimed at trying to improve the quality and the care for children needing palliative care across Europe. And even though they were focused on Europe, in our work globally, we have often referred to and utilized the IMPaCCT standards. So it was felt it was time to revise the standards. So much had taken place, and an international group of experts came together to develop the new standards, a global overview of PPC standards. I haven't quite learned how to pronounce it. I don't know. GO-PPaCCS? I'm not quite sure. But anyway, the important thing is that they're aimed at a global audience. And standards on paediatric palliative care, and they complement the original work, and they build on the original work of the IMPaCCT standards, with the goal to redefine, to look at what needs to change, what can we do differently, to look at not just the European context, but a global context. And to think about the different settings, to think about the different resources, to think about emerging challenges. So, for example, one lot of standards is around the provision of paediatric palliative care in humanitarian settings. We have a session on Friday, I think it's at 4:30, looking at paediatric palliative care in humanitarian settings, and particularly thinking about Ukraine. But key for us in many walks of life at the moment. So the standards, they're aimed at a wide variety of audiences, so the healthcare providers, educators, policymakers, stakeholders, anybody interested in ensuring that we provide good quality paediatric palliative care, and those who are setting up services as well. And they suggest the optimal response, so what we would ideally like. Now, we know that everybody is not going to be able to meet all of those standards all of the time, but it's important to have a goal. It's important to have something to aim for, but it's also important that we adapt those to our own resources and our own needs. They can also guide us as educators, along with the core competencies that have been developed around the world in looking at our education programs. And very importantly, they can help with policymakers. And I've already used them, some work that I did in Eastern Europe just a few weeks ago, quoting these standards and using them in our advocacy for children's palliative care. So this slide's a bit small, but there was quite a detailed methodology. So looked at the previous standards, identified the key areas of interest, did a literature review, looked at what was out there, and then there were different authors for different sections, and an initial draft was generated. And then that was revised and sent out to quite a big global group for revision and for impact. And the draft went backwards and forwards till we came out with the final version, and that has recently been published. So it was quite a thorough and detailed method. And some of the key issues that we discussed was around the definition and eligibility criteria for paediatric palliative care, the great need for paediatric palliative care, some fundamental points, and I'll just mention what they are in a minute, and also that we needed, as healthcare providers, as social care providers, as policymakers, we need to design paediatric palliative care services appropriate for our settings, appropriate models, and importantly, we need to allocate resources. So let's see if we can use these standards in our advocacy for the allocation of resources, so that in each country where we work, we can develop our children's palliative care. So what were some of the key fundamental points that we discussed? And obviously, I'm not going to go through all of the standards in this presentation. We'd be here all day, and you'd all be asleep. So just some of the key things, some of the fundamental points that we discussed. The fact that we believe that paediatric palliative care is a right for all children with a life-threatening or life-limiting illness. The fact that they need and should be eligible for paediatric palliative care. The fact that we should improve quality of life and address the needs and the choices and the wishes of children and their families, and we're going to hear more about that over the coming days. Importantly, it's not just end-of-life care, but that palliative care should be provided for children and their families from diagnosis, and even before diagnosis for those who may never get a diagnosis. That the amount of care should be according to the child's needs, and that there are different levels of palliative care provision according to our training. So yes, there are specialists in children's palliative care, but there are also paediatric nurses who need to provide some basic level of palliative care, or general practitioners, or whoever that might be. And ultimately, the goal is to improve the care of children needing palliative care. So the standards, there's kind of 7 broad categories. The first category is quite large. It's looking at needs. It includes the child's needs. It includes clinical needs, developmental needs, psychological, social, spiritual, communication, family, and ethical needs, and it includes advanced care planning. So that's quite a big section of the standards and a core section. Then there is standards for end-of-life care. Something around care models, care settings where we provide care, and importantly, the issue of telemedicine, and we've seen that that has grown throughout the pandemic. The special settings of care, including perinatal, neonatal palliative care, intensive care, emergency settings. I've mentioned paediatric palliative care in humanitarian emergencies. Issues around care tools and assessment, outcome measures, etc., and education and training for healthcare providers. So they're quite broad and quite all-encompassing. So this is just an example, and the way the standards are set out, they're under the different headings, they set out the standards, and then there's some text discussing those as well. So you can see here, this one is for communication, this one is for paediatric palliative care in humanitarian settings. This one is looking at care tools, such as tools for assessment, outcome measures, etc. It also recognizes that there are areas for improvement, and actually that none of us have got it all right, and that all of us, there's areas where we can improve. Some of those areas were that there's often a gap between what is being done and what should be done, and also what we say is being done. It's not until we do an audit sometimes that we realize that what we think we're doing, we're not actually doing. So there's often gaps in service provision. There's often a lack of legislation for paediatric palliative care. And it's great because I think in Italy there's been some developments in legislation over the last few years, but this takes time, and developing that legislation, getting it passed, can be a challenge. We do need to address existing disparities in paediatric palliative care provision. We know that if you're a child in one part of the world, your ability to access palliative care is very different from if you're a child in another part of the world. We know that children and their families are suffering needlessly around the world, and we need to try and change that, and I know all of us here are striving to do that. We need to look at how the standards are utilized and implemented in different countries. We do need to develop and utilize or share education curricula and adapt them for the context. And there is a need for ongoing development of quality indicators for paediatric palliative care. And there's other areas for improvement as well, but these were just some that we identified. So, in conclusion, these standards, we hope, will be useful around the world. We hope that they'll be useful not just for us as clinicians, but also for policymakers and for developing education and for research and for developing tools and indicators. So we hope that these standards will help guide the development of paediatric palliative care around the world. Excitingly, they were developed by an international group, and we had discussions around different things. Well, that doesn't work in my country, or that doesn't work in this setting. And that really enriched and hopefully developed and enriched the standards. It was based on consensus, so our expert views. Maybe in future it can be more developed more focused on studies as those studies continue to develop and as we look at the work in implementing these standards. And we know that legislation, education, standards, exchange of information, human resources are key, and the sharing of best practices are essential to improving paediatric palliative care worldwide. And that's why it's exciting to be here together face-to-face at this conference so that we can share and learn from each other and develop our services from what we learn at this conference. So, a quick run-through on the new standards. Do look them up. Again, you can Google them and you should be able to access them. Just some acknowledgements funded by the Maruzza Foundation. And authors here, you can see many of the authors are here in the room, and I feel really privileged to have been asked amongst these, all these authors to present this. So it's exciting that we can utilize standards to develop paediatric palliative care around the world. Thank you.